So today my topic is the scalp, and I will start with the layers of the scalp. There are total 5 layers of the scalp, and the first layer is the superficial, which is the skin, and below the skin is the uh, superficial fascia, which we can call as the connective tissue, and here most blood vessels lie. And below the superficial fascia is the epicranial aponeurosis, um, and down to the epicranial aponeurosis is the layer of the loose areolar tissue, which allow the movement of the scalp over the final layer of the scalp, which is the pericranium. And below the pericranium are the presence of the dural venous sinuses, and imagery vein emerge from it. So now I will explain about the muscles of the scalp, and there is only one muscle of the scalp, and here is the location of the occipitofrontalis muscle, and here is the uh, frontal belly of the occipitofrontalis muscle and the occipital belly, and these two bellies are connected to each other by the aponeurosis. And the nerve supply of the occipitofrontalis muscle is provided by the facial nerve. Now I will explain about the nerve supply of the scalp. Here is the preauricular area of the scalp, means anterior area, anterior to the auricle, and the postauricular area. And the preauricular area is supplied by the trigeminal nerve, branches of the trigeminal nerve. Here are two nerves known as the supraorbital and the supratrochlear branch of the ophthalmic division of the trigeminal nerve, and they supply the sensory innervation. The second is the superficial temporal branch of the maxillary division of the trigeminal nerve, and the third one is the post auriculotemporal nerve of the mandibular branch of the trigeminal nerve, and they provide the sensory innervation. And the motor innervation of preauricular area is provided by the temporal branch of the facial nerve. Now I will explain about the post-auricular area innervation, which is provided by the great auricular nerve and the lesser occipital nerve, and these are the part of the ventral rami of the spinal cord. And the third occipital nerve and the great occipital nerve, which are the part of the dorsal rami of the spinal cord. Now I will explain about the arterial supply of the scalp. Again, here is the sketch of the scalp, preauricular and the postauricular. And the forehead area of the scalp is provided by the innervate by the internal carotid artery. The supraorbital and the supratrochlear branches of the internal carotid artery, and apart from the forehead, the whole scalp is arterial supply by the external carotid artery. The superficial temporal branch of external carotid artery, and the posterior auricular artery of the external carotid artery, and the final is the occipital artery. Now I will explain about the veins of the scalp, and like the artery, they anastomose freely with each other, and the veins of the scalp accompanied with the arteries of the scalp, and these are the supraorbital, supratrochlear veins, facial veins, and the imagery veins, etc. Now I will explain about the lymphatic drainage of the scalp, which is really simple. The preauricular area drain into the parotid lymph nodes, and the postauricular area drain into the occipital lymph nodes. Thank you.